Hi everyone, it's Michelle here. This is an update 1 month after the end of radiation, and we are, 5 months and a little more than 5 months out of chemo. So here's my hair growth, 5 months out from chemo. It's all growing basically straight up or out from my head. Had my follow-up, 1 month follow-up visit with the radio oncologist today, and he's very happy with my skin. Everything looks very good. The paperwork that they gave me, which I think I showed in the last video, said to wear sunscreen when out in the sun for like a year of SPF 30 or greater. He said I have no restrictions at all on what going in the sun, swimming in a pool. My skin looks great. This is still there's still just some discoloration on this spot that was the kind of the worst, but it's fine. It's just a little darker than the skin around it, and there's nothing, no restrictions. So he said basically just do the things that we're all supposed to do when we go into the sun, and that is his advice. But otherwise, everything looks good, and I go back in 6 months for my next follow-up with him just to make sure. I will say that I have had some pain, like muscle knots, what feel like muscle knots in my back that my physical therapist says are related to the radiation and kind of some scar tissue that's forming in the tissues inside. And so I am still going to see the physical therapist once every 2 weeks, which I've been seeing since the surgeon cleared me for that. And I highly recommend doing physical therapy after breast surgery, especially the axillary dissection. So she was able to really kind of catch that right away. As soon as I started to feel some pain in my shoulder, she found it. She said, yep, there's scar tissue forming there, and it's kind of pulling the skin from every direction. So she was able to break that up and kind of release it. And I'm seeing a massage therapist at the Integrative Medicine Center that's at my cancer facility. And so basically 1 week I see the physical therapist, the next week I saw the massage therapist, and then this week I'll see the physical therapist again. So they're kind of working it out as we go along. So that's that update from radiation. What else? I am almost at the end. I have two and a half more days of the first cycle of Xeloda. So let me tell you a little bit about the side effects that I have experienced so far on Xeloda. This is oral chemo, and it's 1,500 milligrams twice a day, 2 weeks on and 1 week off, and then we repeat that cycle for 6 months. So I haven't missed any doses. I've been late a couple of times, maybe an hour or two late in the day when I remember to take it, but I haven't missed any. I have experienced some nausea. They prepared me by saying that basically giving me a prescription for Zofran for nausea and a prescription for Imodium, a prescription strength Imodium for diarrhea, because those are the most common side effects. I have not had any diarrhea. I am eating my carnivore diet, mostly clean, a clean diet, mostly carnivore, a few fruits and vegetables that are seasonal right now, and just whole foods, nothing processed. So I think that plays into a lot of not having too many GI symptoms. I have had maybe a couple of times some cramping or in some loose stool, but nothing that I would classify as diarrhea, and I haven't needed to take the Imodium. I have had some nausea. It comes in waves throughout the day, and I would say I think 3 times in the last almost 2 weeks I have felt that it worsened. I had felt some nausea, and I usually wait a few minutes before I just jump to take something, and usually it goes away, but maybe 3 times I took the Zofran so that I did not start to vomit. If you've been following my channel, you know that if I do start to vomit, that can become an emergency quite quickly because of the adrenal insufficiency. Because if I cannot take oral steroids, I basically need to go to the hospital. So I don't want to start vomiting. So if it does start to feel really bad, I will take the Zofran just to get through the cycle. I've had some itchy skin and some dandruff forming, and I don't know, I think that I'm associating that with the Xeloda. Itchy skin can be a kind of a mild histamine response, and it is listed on the side effects of Xeloda. But dandruff, I don't know, I guess because my hair is just kind of new and growing back, and washing it with shampoo, well, I'm not really using shampoo, but I don't know if it's because it's just new hair growing back, or is it from the Xeloda, but I'm equating it to the Xeloda because it's new this week. Other side effects. Have had a little bit of a hidradenitis flare. It was very, very calm all this time, and now I have 2 bumps. Yeah, 2 bumps. And so they're calm, they're staying calm, they're not worsening, but they're there. And then the other thing is just my mood. I definitely feel fatigue pretty much all the time. It's not preventing me from, getting up and doing a minimum amount of things that I need to do in the day, but it certainly is affecting me in that I don't really want to do anything more than the minimum amount of things that I absolutely need to do in a day. And it's also kind of made me feel grumpy. So again, if you've been following my channel, and even if you haven't, it's a good reminder. I really do believe very strongly that we sign up for this life, and that this is just the chapter of life that I'm on right now. This is what I need to do. I need to, for whatever reason, this is what's on my plate. This is the storm ahead of me and behind me, and I'm in it, dealing with this cancer and adrenal insufficiency. This is the life I signed up for when I came here. So I feel very strongly, and I have a very strong faith in that. And I know that I have a good knowing, but the last 4 days, I definitely feel like I have had more moments of kind of a little bit of self-pity, a little bit of worry of, and that voice in your head that tells you that something sucks. That voice, that's not me. I know that's not me, but I hear that voice, and it seems to be very loud the last 4 days. And I, when the pharmacist called, the pharmacist that sent the Xeloda, called to check in, he asked kind of how I was dealing with the Xeloda and if I had any side effects. And this is one that I mentioned because I really feel that I am always, whenever I have had moments of feeling down, I'm always able to look at it, recognize it, and then do some meditation or some affirmations and really kind of turn it around and look at it and visualize myself on the other side of that, and then let go of those feelings and move past them really easily. And this week it's been a lot more of a struggle, and I had a good 3-day stretch there where I was just in a poor me kind of mood. And so I think it's important to recognize that. The pharmacist did say that depression could be a side effect. I wouldn't classify it as depression. It's just kind of that I keep not focusing on the better things. I have to really look for them a little bit more this week than I have in the past. But I've got 2 more days of the Xeloda, and I'm blaming the Xeloda, and I realize that. And maybe it's just, who knows? But I feel really strongly that it's somehow related to the fact that I'm, taking the poison every day. And I wanted to mention that because I think if you are on a new drug and you start to feel other than yourself, then I tend to equate that to that drug. And I think that is I'm pretty sure that is what is the cause of that. So tell your doctor if you're taking a drug, any drug, if you're taking any medication and you start to feel depressed, or you start to feel anxious, or you start to feel somehow other than your normal self, tell your doctor, because I really feel like that's important. So I have the follow-up with my medical oncologist next Wednesday, as well as the plastic surgeon. And so I'll probably post another update shortly, probably within a week, because I'll have that update after I see them. All right, those are the big points. So we are, again, hair growth after 5 months plus a little bit of chemo, and an all clear, no restrictions on activities 1 month post radiation. And that was my side effect update on the Xeloda. I am overly sensitive, paying attention to my hands and my feet. And so there have been a few times where I felt like my hands and feet felt hot that I'm like, oh, is this the hand and foot side effect? But I'm just keeping them really moisturized. And once I put moisturizer on, they feel better. So nothing to report there with my hands and feet. Everything's normal. So have a great day. It is a lovely day here. As you can see, I'm sitting outside, and I will see you soon. Hi everyone, my name is Michelle. I started this channel to document my journey with stage 3 metastatic triple-negative breast cancer. I'm fighting my cancer from a holistic approach using both conventional standard of care and alternative therapies, as well as a carnivore ketovore diet, which has healed many other long-term health issues for myself. During the course of chemotherapy and immunotherapy, I also developed Central Adrenal Insufficiency, which they tell me is permanent. So, as I continue my journey, there's more story to tell. On this channel, I will share things about cancer treatments, adrenal insufficiency, carnivore, ketovore, and maybe some non-carnivore cooking recipes as well. Family, faith, philosophy, spiritual awakening, light work, non-toxic or clean products, and anything else I might find interesting. Thanks for following along on my journey, and please like, subscribe, and share if you find anything of value. Thanks so much.